You can fly higher than the sky, shine brighter than the stars. You can have all you ever wanted.
This week on the show, we have Dr. Amy B. Lewis, an associate professor at Yale and cosmetic dermatologist. Hello and welcome. Thank you so much for watching. This show's all about giving you insights and showcasing brands that help you to live your best life and give you confidence. As always, I want to kickstart your morning with some motivational advice to help you to feel inspired and energized to start your day. Today, I want to talk about understanding the importance of surrounding yourself with people who inspire, respect, and uplift you rather than drain your energy. The truth is, who we surround ourselves with has an impact on how we feel. We can leave an encounter with someone feeling inspired and happy, or feeling completely drained from the other person's energy. This is why it's vital to be surrounded by people that you admire, love you, clap for you, and importantly, encourage you to keep evolving. Successful people respect their time and value and understand what they bring to the table in their relationships. Therefore, they ensure that the people in their life are only amongst those that are cheering them on, supporting them, and are proud of their friendship. It boils down to the quality of their circle rather than the quantity. Rather than wasting your energy on people that don't match your energy or see your value, focus your energy on improving yourself, and the universe will bring people into your life that match with your positive energy and outlook on life. As Oprah quotes, surround yourself with only people who are going to lift you higher.
Stay tuned. Coming up after the break.
And I wanted to ask, is SoftWave for someone like me who doesn't have wrinkles but obviously wants to prevent, premature aging, or is it for people only with wrinkles?
No, so as I was saying, you really want to start before you need it, right?
Yeah.
Because then you won't actually have to need it later on.
Mm-hmm.
And you just want to keep that collagen going. So you should start early, and it will prevent the loss that you inevitably would have. People say they don't want to turn into their mother or their father, right? This is a way to keep your skin in better shape than they didn't have this when they were our age, right? So they didn't have this option. So they should definitely start younger. And I think it's for everybody. And what's really nice about it also, it's colorblind. You can use it on dark skin, light skin, it doesn't matter because it bypasses the outer layer of skin and goes underneath. So we call it colorblind, which means you can use it on any color of skin.
Wardrobe provided by H&M. Next up on the show, we have Dr. Amy Lewis from Lewis Dermatology, who will be speaking about Sofwave, a next-generation ultrasound treatment for fine lines and wrinkles. Dr. Amy, thank you so much for being on the show today. How are you doing?
Good, thank you for having me.
Yeah, thanks for being here today. So let's talk a little bit about your background as a dermatologist.
Sure, so I'm a cosmetic dermatologist in New York City. I've had my own practice here for about 20-something years. And I also teach at Yale, and I teach a cosmetic clinic up there, and I train the residents in cosmetic dermatology.
Very nice. And, as a dermatologist, what are the top skin concerns that you find that people have?
So some of the skin concerns that kind of are across all ages are sensitive skin, dry skin, acne prone, pigmentation. We get people asking about how do I improve the texture and the tone of my skin versus pigmentation in the skin, whether it's red pigment or brown pigment. And then as you get a little older, they start asking about sagging, laxity, fine lines, wrinkles. That becomes more of the issue.
Yeah, absolutely. And, I want to talk about, I know that your clinic also offers Sofwave technology. So what is it exactly and how does it work?
SoftWave is an ultrasound technology, which is really nice because they're ultrasound waves. There's actually 7 beams that go under your skin and cause an ultrasound heat that coagulates the dermis. By coagulating the dermis at a certain temperature, it causes collagen remodeling. By remodeling the collagen, you stimulate your collagen to grow, causing more even collagen and elastic tissue. When you improve elastic tissue, you get better spring back to your skin, which we all want, right? So that's a way to get a non-invasive technology, a treatment with no downtime at all. You can walk right out of the office, there's no redness, there's no swelling, there's no bruising, and it can give you fine lines and wrinkles improvement, or you can go for actually lifting, some tightening here, jawline, neck, or brow lift.
Yeah, absolutely. And I know as we age, we lose collagen. So talk to us about that and why we do.
So you know what's really interesting is that people don't realize that you start losing collagen at about the age of 25, right? So there's a curve where you start going way down after 25. It takes about 10 years before you actually see that. It's interesting to me that people don't realize you should start early. You should start before you notice the signs of the loss of collagen. It's like when someone's losing their hair, you don't notice that you've lost your hair until you've lost a lot of hair, right?
Yeah. Mm-hmm.
So why don't you start before, when it just starts, the hair loss. Same thing with collagen. So you should start doing things to improve your collagen and to keep the revving up of your own biological collagen process going. So that's one of the things that SoftWave and some other techniques that can improve collagen are used for.
Yeah, absolutely. And how does it help? How does SoftWave help to build collagen? What's the process like?
Because you come in, it looks like a laser, right? But it's not a laser because it's ultrasound. So ultrasound, it feels like heat, and it pulses on your skin, and you feel the heat. It's tolerable. You can use numbing cream for sure, but it's a totally tolerable treatment. And you just don't get red on the top, and the energy is underneath the skin in the dermal layer. And then they've actually done biopsies to show that after this treatment, weeks later, they increase the collagen underneath that layer. So you're basically increasing the collagen in the dermis, where our collagen lies, right? So what's really important about that is it takes about 6 weeks for collagen to start to grow after a procedure. So it's important to understand that you might get some initial tightening after the procedure, but you're still going to be cooking, really, for at least 6 weeks to start and for months after. So you're not going to see really the improvement and the full effect of the treatment for months later, which is kind of nice because you're looking in the mirror all the time and you're expecting to look older and older, and you're actually looking younger and younger as the weeks are going on.
Yeah, absolutely. And I did see some before and after pictures on the website, which are really, really drastic. So let's talk about some of the testimonials people have had after they've had this SoftWave treatment.
So people are amazed. A lot of people come in and they say, oh, I had no downtime, so of course it couldn't work. You have that mentality that you have to suffer in order to get a result, right?
Yeah.
That's not so true anymore. So what's really nice is it's an FDA-approved treatment. Back a couple of years ago, the first FDA approval was for fine lines and wrinkles and tightening. Back in 2020, 2021, they did a huge pivotal trial. They submitted to the FDA, and they went for the approval for lifting. They went for brow lift, under the chin lifting, and neck lift. And it's really hard to get that approval because you have to send a lot of studies and a lot of measurements, and a lot of those studies are pictures that you saw, right? Mm-hmm. And there were some older people that you wouldn't have thought would have gotten such a great result, but they really did. Mm-hmm. So after they submitted that to the FDA, they actually got FDA approval for all 3 areas for lifting, which is really impressive, actually. So the way they did that was they did 2 treatments, 6 to 8 weeks apart. For the initial, if you just need some fine lines and wrinkles, then you can just do 1 treatment. And then just go to maintenance as you age, maybe once a year or something like that. So if you want to get more lifting, then sometimes we add another treatment, and then you go to your maintenance therapy. Because remember, we always want to keep your collagen regenerating more. Because it's all of us, as we age, our collagen is starting to go down, our collagen production. Like the factory is just not working as well. We want to boost that factory up. So that's what it does.
Absolutely. And what are some areas, I know you touched base about it earlier, but what are some areas that SoftWave tackles? Is it just for the face, or is it for the body as well?
You can actually do the body as well. So off face, especially neck. Neck is a big area that we do. It's probably the number 1 area that people complain about. And then you can do chest, and we use it on above the knees. People get this wrinkling above the knees. Yeah. And on the arms is another area for like the laxity under the arms. The upper arms. You can use it on the stomach. Anywhere where there's lax skin, you can actually get some tightening from the procedure. But I can tell you that probably neck and jawline are number 1 of the procedures that we use it for.
Yeah. And what are some other treatments that you guys have at Lewis Dermatology, out of curiosity?
We have a lot of great choice here, actually.
Yeah,
we have Neo-M Sculpt to increase muscle and decrease fat at the same time, which also can tighten a little bit of the skin above that. We have Do-Cool Sculpting for body sculpting and getting rid of fat. We have the Pico Laser, which does all pigmentation and tattoo removals. We have vascular lasers. We have IPL. We do peels. We have plasma lasers and CO2 for resurfacing to get rid of fine lines, wrinkles, tighten your pores, give you a refreshed look. So pretty much anything you could possibly think of, we probably have it.
Absolutely. And your skin looks great, by the way.
I actually had a Sofwave about 6 weeks ago.
Oh, very nice. So it's definitely working for you. And I wanted to ask, is Sofwave for someone like me who doesn't have wrinkles, but obviously wants to prevent, premature aging? Or is it for people only with wrinkles?
No, so as I was saying, like, you really want to start before you need it, right?
Yeah.
Because then you won't actually have to need it later on. And you just want to keep that collagen going. So you should start early, and it will prevent the loss that you inevitably would have. People say they don't want to turn into their mother or their father, right? This is a way to keep your skin in better shape than they didn't have this when they were our age, right? So they didn't have this option. So they should definitely start younger. And I think it's for everybody. And what's really nice about it also, it's colorblind. You can use it on dark skin, light skin, it doesn't matter because it bypasses the outer layer of skin and goes underneath. So we call it colorblind, which means you can use it on any color of skin.
Yeah, absolutely. And for someone that's going into a treatment, what can they expect? Because sometimes some of these treatments, you don't know what to expect and you're obviously scared to go in, right? So what can they expect from beginning to end?
So someone will come in, we usually put some numbing cream on them for like maybe 20, 30 minutes, right? And then we start the procedure. Now, if you do not have a good pain threshold at all, you really don't want to feel anything, we have other options where you can have like a nitrous gas where you kind of like float away a little bit and you feel like you don't feel you feel nothing. And so somebody who doesn't want to feel anything has that option. Most of the patients just opt to have the topical numbing cream because it's really not that uncomfortable. It feels like little heat snaps. So you go through the procedure, probably takes for the full face, maybe half an hour. If you're doing face and neck, 45 minutes. Sometimes you just do the upper brow lift, and that takes maybe 15 to 20 minutes tops. And when you are done, there is nothing on your skin. There's no redness, there's no swelling, there's no, pigmentation, nothing. You just look tighter immediately when you're done. And then they go home. And it's one of the few procedures that you can do and have no downtime and no hint of anything right after. So you can go under the radar.
Absolutely. And, I had a BBL halo treatment and it was quite painful. And my skin was very red for about a week. But I had great results. So what's the difference between the two?
So you're talking about something that's going to be superficial on the top of the skin, right? For pigmentation, maybe some tightening topically, maybe helping with the pores, where we're going underneath the skin. So we're bypassing the epidermal layer. So that's why you're really going kind of from the inside out, and we're going for deeper fibers. We're getting more collagen regeneration deeper to get more lifting. So they both work well together because you're doing two different things. Like SoftWave is not something you would do if you wanted to get rid of pigment. If you want to get rid of pigmentation, you could do a BBL, an IPL, a intense pulse light type thing, or a pico laser, or some peels. There's so many options out there. That's not what SoftWave does. SoftWave does more of the sculpting, tightening, lifting, and keeping the collagen growing so that you have the elasticity in your skin.
Yeah,
but
and
as we age, we have both things to worry about, right? Mm-hmm. So that's why we have multiple toys to use.
Mm-hmm. And what's the depth required to treat wrinkles in the mid-dermis?
So this goes 1.5 millimeters under the skin surface, and that happens to be the perfect layer to get the dermis to get the regeneration and the collagen remodeling. And there's some other devices that obviously go that depth, and some go a little deeper. You can go a little deeper. You don't have to for certain, like microneedling for instance, there's microneedling radiofrequency machines which can help tighten the skin, and they can have different depths. But this depth seems to be really working. They did biopsies right after, weeks after, to show right at that depth that's where the collagen is actually increasing. So it's there are different layers that you can actually target, and this is the perfect layer to target. The nice thing about this machine is that there are 7 horizontal beams that are going together, so you're getting a great, I call it like bang for your buck, per pulse. Mm-hmm. You get a lot of energy going right in that one layer per pulse. So every time you feel that little bit of heat, you're getting a lot of area covered, which is kind of nice.
Mm-hmm. So is there any pain in this at all, or is it just like a slight pain?
I'm not going to say it's painless. It's definitely, you feel the heat, you feel like a little bit. What happens is you count to 10, and when you're up to like 8, you're like, oh, it's starting to hurt, but then 10, it's done.
Okay.
So each pulse goes, you count to like 10 in my head. So it's some people again don't want to feel anything. We give them the nitrous. It's called Pronox, and they control it, and so it's up to them to inhale as they want, and they just feel like they float away a little bit. You feel a little bit like woozy. You don't really feel the pain, and the second you stop it, it cuts off. So it's not like that. It doesn't have any hangover. There's no residual effect. So a lot of my patients who don't want to feel anything, they use that, especially if we're doing full face and neck. So it's a longer procedure. They don't want to feel anything. They just want to zone out. We give them the Pronox. If you're just doing a partial area, maybe just the brow, just the neck, something like that, it's pretty fast. It's totally tolerable with numbing. The nice thing is when you're going 1.5 millimeters under the skin surface, the numbing cream can help. It can actually help down there. If you're going really deep, the numbing cream is not going to work. Mm-hmm. So it's something that can actually be affected by numbing cream to help with the pain or discomfort. I wouldn't call it pain, I would call it discomfort, but it's totally tolerable.
Mm-hmm. And can someone pick whether it's a lighter treatment or a deeper treatment?
Yeah, so that's a good question. So if somebody wants like just some fine lines and wrinkles, maybe a little tightening, and they want to just prevent, then we do a certain number, we have different energy levels, and we would stay on the lower energies, and we would do, say, 2 passes in different areas, and that's what the first protocol was. If somebody has more sun damage and more elastic damage, which means they're more saggy, then we want to push our envelope a little bit. So we might push the energy a little bit higher, and we will do more passes. We'll do 3 to 4 passes in an area and different vectors in that area to try to really get that area to boost more collagen and get more lifting. So we'll tailor it to the patient for sure. So somebody who has one need gets one treatment, and someone who has a different need will get a different type of treatment.
Mm-hmm. And you mentioned there's no downtime, but I know that sometimes your skin can be sensitive to the sun after. So do you guys have any treatments after? Like, do you need to wear a certain cream or stay away from the sun after your treatment?
So for a lot of treatments in my office, the answer would be yes to that. Mm-hmm. If I'm doing any CO2 resurfacing or even peels or something like that, for this, no. You literally are bypassing the outer layer of the skin. You do not have any increased sun sensitivity. You don't get red. There's the positive to that is literally it's nothing's on the outside. Downside is if you have some pigmentation, like I said, it's not going to treat that, but we have other things for that. So this is a great treatment for a lot of people who want no downtime, great results, and minimal discomfort, right? So, and you really don't have to put any creams on after. Just go back to your regular regimen. It doesn't stop you from using your Retin-A if you're using that, or glycolics, or, I'm not going to tell somebody to go sit in the sun, obviously. Yeah. But you wear your sunblock every day anyway, right? Mm-hmm.
Mm-hmm. And what are some results that you've seen with it? Because your skin looks great, and you said you just had the procedure. So tell us about your specific experience.
So I like to try like all my toys, So if I'm gonna tell a patient, I'm gonna recommend to a patient, I want to know how it feels. Yeah. So I can explain it better. So it's hard for me to say it feels like something if I don't ever try it. So I just suffer through trying all my toys, right? So it feels like little snaps. I would say there are a couple areas that I would call a little uncomfortable, and that's more areas where it's on the bone, like on the forehead or the jawline. Those would be a little more uncomfortable, but then the next one I might not feel at all, the next pulse. So if you have, the way we usually do it is if we have a couple areas on the jawline to do, we'll do a jawline area and then we'll go to someplace else that doesn't hurt and we'll go back to jawline. So you're not uncomfortable for, a few minutes at a time. So it's just a few seconds and then you're over it and then we move on. It's funny because this is one of the only procedures I can't do on myself. Mm-hmm. If I can do it on myself, I would, but I can't do this on myself. So when I was having it done, I know the more passes and pulses, the better results you're going to get. So after we're done, I was like, do more. Just do more. So obviously I wasn't in pain because I kept saying, do more, I want more. Yeah. I was just waiting, I want the results to kick in, So I want to be as tight as I can be with looking naturally, because this is natural, right? There's no surgery, there's no cutting, there's no suturing, it's just a natural, non-surgical lifting, which if you think about this, years ago, we had no options like that.
Yeah, Absolutely. I like non-invasive treatments because I'm afraid to ever get anything invasive. So I think this is something great for me. And they did offer me to try it. So after you told me, I think I'm actually going to give it a go. And Dr. Amy, the big question is, how much do these treatments cost? And how many treatments are needed to really see results?
So the first protocol that we talked about for fine lines and wrinkles was, the protocol was really one treatment. And then often we would say to come back in 6 months, do a second, and then go to maintenance, which would be like once a year. If we want to do a lifting protocol, that's what I call it in my office, the lifting protocol, and I want someone who has more sagging, then we're going to do 2 treatments, about 6 to 8 weeks apart, and then we're going to go to maintenance, which is usually about once a year. If someone, obviously, we see in the pictures before and afters, if someone has, is much more wrinkly, has a lot of sun damage, maybe in their 60s, 70s, or 80s, they might want to do more, because when you increase the collagen from SoftWave and then you do it again, you're starting at that point. People always ask me, how long does it last? It's not like it goes away. You age from that point on, right? So if you start from that next point, then you're as if you're at that point to start with, and you're going to rejuvenate and get tighter from that point. So it's a nice way to keep tightening your skin over time. So it's not like you have to stop the treatments. You can do, and you don't have to keep doing them. The cost is a difficult thing to answer, just because sometimes we just do a brow lift, which could be anywhere from $1,000 to $1,500. If we're doing full face and neck, it could be $3,500. If we're doing lower face and neck, which is very, very common, it could be anywhere around $2,000 to $3,000, depending. Also depends on how many passes you're doing on the patient, because you want to get a lift versus just tightening. So again, there's the ranges. I would say probably the least expensive is $800 if you're doing maybe around the eyes, or just a miniature brow lift or something like that. But it's affordable, and we can tailor it to you, like just the areas you want. If you don't want to do your whole face or face and neck, and it's like I said, it's an easy thing to sit through. It's not a difficult thing, and believe me, I've tried a lot of different procedures, and some I want to jump off the table. This was not one.
Yeah. Is it safe for all areas on the face, like around your eyes, which is very sensitive?
So, there's a lot of other procedures. You have to worry about nerves, and you have to worry about structures underneath. Here, because you're only 1.5 millimeters underneath the surface, there's no major vessels that you have to worry about, or no nerves you have to worry about, and you can treat almost anywhere. So that's why you can actually go around the eyes and tighten the skin around the eyes. And you can lift the skin off of the upper brow there and against the bone, and we treat around here to give a lift there, which is really a nice thing, because there's not that many things that can do that. And you can basically, wherever you want, we can treat it.
And for our viewers that are international, I know you're based in New York. Where can they find SoftWave treatments locally and find out more information?
So you can go on their website, on softwave.com. You can also, there's a big social media presence, right, with SoftWave. You can look at online at Lewis Dermatology. We post a lot about SoftWave, and I actually posted a lot of about me teaching it to the residents a couple weeks ago. And so it shows you how I was teaching them and explaining it to them, which shows you like where some of the questions that you asked me, like how deep does it go? What does it do to your skin? That kind of thing. But there's a lot of information on the web. And you can also, if you have other questions, they can call my office in New York City. It's 212-288-6133. We're happy to answer questions, send you information. And, if you're in the area, obviously, come on over and we'll treat you.
Amazing. Well, thank you so much, Dr. Amy, for being on the show today. If I'm ever in New York, I'm definitely going to check you out.
I'm going to hold you to that.
Yeah, I will definitely. And I think I'm going to get this treatment after speaking to you, because it sounds pretty good. But yeah, thank you so much for being on the show today. And we hope to have you back soon.
Thanks.
Tag TV is available on Roku, Amazon Fire TV, Apple and Android TVs, as well as on Apple and Android phones. Watch us live through YouTube and Facebook.
You can fly higher than the sky.